Hello, everyone. Welcome to another podcast with Elevated Medicine. This one is for the April-May time period, and some of this material may find its way in as bonus material for our symposium that goes live July 15th. So I'm going to turn over this program currently to Stephanie, who's going to introduce the topic and the speakers today, and then we will go from there.
Welcome, everybody. Grab your coffee, and I just want to invite you to come and sit with us and learn along with us. We're here with two lovely ladies, Karen Gadol and Pam Holloway, and both of them have really humbly laid aside their previous understandings of medicine and have uh, grabbed hold of the the education that is coming this out like a volcano and a fountain. And they're
Mhm.
here to share some of that with us. Let's see. Let me first start with Karen. She's been a physician's assistant for 27 years. She's in Charleston, and in about 2000 is when she first got into holistic medicine and integrative health. Pam Holloway, I should see to the right of your screen. She is a regenerative health strategist with 30 years of experience in clinical care, international health systems, regenerative agriculture. She even started an agrarian. She's an agrarian. She started a 1,200 acre farm with her husband. And she also works with environmental wellness. She has a Master of Science in International Relations and Business that informs a lot of her work at the intersection of medicine, policy, and large scale systems leadership. So we're very glad to have her. She's the founder of Ozonated Glycerin, which is OG Pro, and she's the author of OG Pro Notes, which is a provider's guide on how to use that and why. She's also the founder of healthrecoveryministry.org and Radical Resilience Health that she began during the COVID pandemic because she saw how much help people needed and weren't able to get. In her past, she's been the deputy director of the U.S. Army Wellbeing Program. So we're very lucky to have her with us. And Karen is helping get her into places that need education and introducing some of this work. So, Karen, how did you first meet Pam?
Thank you. I actually met Pam in February at a conference. We were there together. We met over lunch. And the more she shared, the more I learned that I needed to know her and know what she was sharing. I tell people all the time, even though I've done this for 27 years, the more I learn I don't know. And she had an awful lot of wisdom to share with us at that lunch table. And so I really reached out after the conference because I don't take any meeting as random. I felt like it was a kind of an ordained time to be together, but really felt called to bring her hopefully to South Carolina to share with local providers. I believe as a community, we're all in this together and we're just trying to help people be well and to remain well or recover their health. And so we've just known each other for a few months, but she's a wealth of knowledge and experience, and I'm honored to be with her here today.
Mhm. Me too. And what was it about her work with ozonated glycerin that caught your attention?
Well, I'd heard a little bit about OG, but I'm not an ozone practitioner, and just really the diverse application. It could be used topically, it could be used as an IV, or, in the dental world, it kills bugs. It can be used in lime. It can be used in mold. It can be used in almost every field. And it was just this um, weapon, if that's the right way to say it, this beautiful tool that could help almost anyone. And I've been educating myself on as many recordings and teachings as I can hear from both Pam, but also Dr. Jim Bridge, who she works with, who's a veterinarian. And it's just incredible what it does and what it does in the body and its role in helping to regain and maintain health. And so, just one of those things that I felt called to help us all learn and grow and be more prepared.
Mhm. Well, I'm excited to get into that. What a broad influence this sounds like it has. Um, Pam, why and how did you become interested in ozonated glycerin?
That is actually the $10,000 question right there. COVID, just straight up COVID. I knew about ozonated, ozone medicine before that, had dabbled in it, had worked with it a little bit, but the reality of the situation is for particularly for a home use situation, the beneficial way to get home use of ozone into the body was rectal insufflation, and most people just aren't willing to do that. So it wasn't accessible. And yet I knew from looking at what was going on with ozone that if we could get people to use it, that we could really knock out a lot of what we saw during COVID. And I was like, gosh, there just has got to be a better delivery mechanism. So I stumbled across Dr. Jim Bridges. He did a short little interview, and as soon as I saw that and then saw where he was going to be at a small training in person, I was just like, I'm dropping everything. I'm going to that training where it was just a small, intimate environment where there was a dozen of us. And I'm going to meet with him one-on-one and just literally say, hey, this is what we've been looking for to be able to be antiviral, antifungal, antibacterial, antiprotozoal,
Wow.
and to be able to have something that was stable that someone could administer to themselves, as well as practitioners being able to use it in their
Mhm,
practice, which can
mhm,
extend what the practitioners are getting for an impact
mhm,
in their patients. I'm like, this is it. This is what I've been
mhm,
looking for that
mhm,
really is a game changer. It's a great little Swiss Army knife. It's not a miracle, okay? It's a tool in the toolbox. But when used appropriately, yeah, we didn't have to experience what we experienced during COVID. Not at
Mhm.
all.
And I want to add, that was one of the things that attracted me was that even if we didn't have a local provider using OG in the office, it's something people could educate themselves with and use at home. And it's a way to start and available to anyone and safe. We'll go there, shortly. But I think it's really important that you don't have to have, yes, you want to have a provider, you want to have a practitioner, but you don't have to. There's education out there and it's available.
Well,
So,
and that's part of the reason why we created OG Pro is
mhm,
is to have that decentralized base that can really support people, bring practitioners on board, get practitioners up and running so that when we do need injectable forms of it, we can, get people off to where they need, where they can get the injectable support. But at the same time, we can nebulize. And that right there, I mean, using the lungs as that, the way we were using rectal insufflation before, we can now use the lungs. And a lot of people are willing to nebulize. They're willing to do oral.
mhm,
So it just opened up a whole new spectrum of being able to support. And we've got story after story of people nebulizing, knocks out colds, great to use while you're traveling. We tell people now to use it as a nasal spray when they travel because you can puff it and then you can use it as a nasal spray, knock things out when you're in those intense travel situations. And it's shelf stable for a period of time.
Okay. Well, what is it?
Ozonated glycerin is actually quite a little gem of a molecule. What you're dealing with is a glycerin molecule that has ozone on the inside. And so as the glycerin dissipates off and opens up, what literally happens is the ozone is released. And so you've done a fabulous job, Stephanie, with just bringing up this slide here that it's like 1% of ozonated glycerin is surrounded by 99% glycerin. And so as that glycerin starts, dissipating off through the field in the body, it releases the ozone. And so particularly when you think about cancer, well, cancer loves what? It loves sugar. So it goes after that glycerin molecule, wants to use it for fuel, and then it encounters the Trojan horse, which is the
mhm,
ozone on the inside, which does a beautiful job of getting rid of knocking out cancer and a whole bunch of, the fungal and all of the other things. So with that, that ozonated glycerin is a slow, long-acting peroxide. If you go to that next slide, we actually have that description there. Um, but it is a very slow reacting, slow release, lasts up to 4 weeks. So we're using this right now in some trial cases. We've got a couple of clinics that are working hand in hand, one here in Colorado, another one in Maryland. And we are actually putting this into the intraperitoneal space. And what we are seeing is that it lasts 3 weeks, sometimes up to 4 weeks in that intraperitoneal space. And we're using this in combination with some other therapies, and we are watching those cancer markers plummet.
Oh, wow.
So 1 milliliter of oxygen of ozonated glycerin has 10,000 micrograms of singlet oxygen. And so it's an oxidative therapy because it's low and slow. So think of hydrogen peroxide, more gentle, longer acting. And what we're seeing in that is that we see less Herxheimer reactions. So
That's
it really is pretty remarkable as a tool.
Yeah, because anybody with these complex chronic illnesses, when they start their treatment, they're really, really suffering, even to a greater extent. That's excellent.
Yeah, so one of the things that, and this is an area that particularly since 2020 has become much more pronounced that, less is more, okay? Yeah, we don't need to be hitting things with a hammer most of the time. There are times where we need to, but a lot of times that slow, low consistency really does give us the greatest gains. And this is something that people can start at home on their own.
Well, some people have heard of glycerine, like glycerin with an E, or they've heard of glycerol. What is the difference between glycerin and glycerine and glycerol?
They're actually all the same thing. Those are just country differences as far as, spelling. That's one thing. And glycerol is typically what it's referred to from the chemistry side of the house. Whereas if you're in more of the pharmaceutical language, it's glycerin. So they're actually all the exact same thing. As far as glycerin goes, glycerin, this is really more the point that needs to be made here. Glycerin can be made from a palm oil. It can be made from soy based. It can be made from coconut oil. And so the thing with glycerin itself is to make sure that wherever you're sourcing your glycerin from, if you're making ozonated glycerin yourself, and we do teach people how to make it themselves in their home for home use. Anytime we're doing an injectable form with the practitioners, we really, really encourage you to use a particular provider of manufacturer of ozonated glycerin that's been well tested, has CGMP, all of those types of things. And in particular, what we're finding is using organic coconut glycerin is what we're recommending for the most part, unless, of course, the person has a severe coconut allergy, then obviously we may want to look at a different source. So it's a like you're saying here, showing on this slide, it's glucose peroxide. It releases oxygen, and then they use the glucose for the fuel. There's also a correlation here with glycerin and what we're discovering it does with the glycocalyx. And, it's too much to get into the glycocalyx here for the purposes of this discussion today. But I'm in the process of writing the book right now with the help of a brilliant physical chemist, Dr. Barry Ninham, who has a PhD in physical chemistry. His life's work has been proving that the glycocalyx exists. We now have actual visuals of the glycocalyx, thanks to Dr. Hans Vink. And we actually now even have the ability to measure the glycocalyx. So I don't know if you can see this here or not. This is actually a camera that we use that allows us to, under the tongue, see the state of the glycocalyx with the red blood cells flowing through one by one. Now, there's a connection here to the ozonated glycerin. The glycerin, the glycerol, actually supports the glycocalyx. So we're actually working through the how does this work right now, and that will be coming out in the next book that we're putting together right now, which is going to have a much deeper dive on all those areas. In the meantime, what we do have is we have the Ozonated Glycerin book. People can find that on ogpro.org, ogpro.org, as an ebook or as a physical copy, which can give individuals and practitioners, the do no harm, here's how you get started. But we are writing that next book, which will be, the tome, going much deeper on the science and everything. But there really is something about the glycerin and the oxygen together that is truly remarkable.
Well, and I know we're not going to get super into it, but most people don't know even where or what their glycocalyx is. Will you just explain what that is so they know if
I
they,
can, and actually, you've got a slide in the deck there that we can even throw that picture up for people so they can see that. But what the glycocalyx is it is like a gel-like lining. If you go down towards the bottom of that presentation, what you'll see, and thank you for, your patience of flipping through. Okay, see that person? Hold on, back, back, back. I think it was slide number 33. There you go. If you take a look at that slide right there, you'll see this is like your take a picture of this slide. Your endothelial glycocalyx is, 30 years of research have gone into it. You can actually learn more at glycocheck.com for any practitioner who wants to go in there. There's an entire research page there that you can dive as deep as you want to. And full disclosure here, I do have an affiliate with them. And if practitioners put it in order, or if lay people put it in order, if they use the discount code PAM, PAM, they can actually get a discount on their order from that site. But the glycocalyx is the largest surface organ. It's 10,000 square feet. We always thought that we're taught the largest organ was your skin. No, it's actually the glycocalyx. It's that gel-like lining that lines every single capillary. And you can see here, it's like literally 75 microns across. And it kind of looks like if you were to look at the ocean bed and you were to look at the seaweed and how the seaweed flows back and forth, that's exactly what the glycocalyx does. And then it literally allows for the nutrient transport as well as the waste transport. And so with that nutrient and that waste transport, we're also seeing the improvement of oxygen, which is where the ozonated glycerin comes in, delivery into that capillary level. And here's the part that's really crazy. By measuring the 4, 5, and 6 micron capillaries, we can determine the health of the vascular system much better than we can through any of the cardiac means that we're using at this point in time. We're constantly looking at the 1%. We're not looking at the 99%. And if you go to that next slide that's directly behind this one, you will see, whoop, go up. Sorry, go up. Wrong direction. That was
oh,
wrong. I took you the wrong, or you're going the wrong. There we go. There we go. That this here is an actual photo. These are actual photos of the insides of those little tiny capillaries. And you'll see that the one there on the far left lower, that when you see that long, hairy structure there that looks like seaweed on a bed, on the bed of the ocean floor, that is a healthy glycocalyx. An unhealthy glycocalyx looks like the grass has been ate down to nothing and you're in a famine. I mean, that is what an unhealthy glycocalyx looks like. And what happens is when we get into that unhealthy glycocalyx state like that, the body will try to heal itself and it will try to put plaque over the top of it. So when we see those situations where people are going in and they're needing stents, that's because their glycocalyx looks like this. Now, if we were to actually repair the glycocalyx, and we know that fucoidins actually repair the glycocalyx, that if we were to, and there's some other things too that really help support, if were to repair that glycocalyx, you wouldn't need a stent. I have
oh,
seen renal disease reverse. I have seen, I had one individual who had had a TBI from 30 years before, had floaters in her eyes. She started double dosing on the Revasca product that this company sells. 6 weeks later, those floaters in her eyes disappeared. Now, do not just go out and jump on this stuff, okay? It will rapidly change blood sugar levels. It will also rapidly change blood pressure as it's doing its job. So if you have a patient who just slams and starts taking this, you could actually have some beneficial but unintended consequences rebound type of effect going on. So it's not something to jump into lightly. That is, as far as I'm going to go into it here, there's a lot more information on that. There is the possibility of May 22nd. I think, Karen, you were looking at doing something. Did you want to share about that?
Well, we're hopeful that we'll get you into town, into Charleston, and invite practitioners to come in and learn more about the glycocalyx, the benefits of OG for the glycocalyx, bring the camera. People could get tested, with the hopes that we will then go out and disseminate this information to our patients and clients to have them come back in at another date when Pam would come in and kind of test the population, or not the whole population, but test our patients and clients. Because again, to my knowledge, there's not even one of these cameras in the Southeast. And yes, that so important for cardiovascular health. But when you think about it, your vessels line every organ, every aspect of our bodies. So we're talking everything from brain health to pancreatic to kidney. It's not just the heart. It is absolutely the heart, but it's not just the heart. And so just when we think about wellness, I view this as being truly one of those foundational root causes to disease that is largely not even known of, spoken of, ignored, just brushed over because maybe we don't know what to do about it, or we don't even know that it exists. So that's hopefully we're going to get Pam in and educate and share on May 22nd.
Well, and I'm really hoping that, Karen, that you or your colleagues there will, certainly start getting your own tools right there in the area so that you could support your patient population. And I can certainly, give you the education and the training while I'm there so that that can happen.
Wow,
Absolutely.
I
So
can just feel the hope that people just hearing when you hear that you have to have a stent, it's just so like, it hits you, and to think that there's another way, that's beautiful.
and to have that early awareness that there is something, number one, I need to do and something I can do. Because even from a genetic perspective, there can be some awareness that your glycocalyx maybe even wasn't very strong out of the gate. And there are things we can do to protect it. So it's one of
Well,
those foundational things.
here's the part that's really crazy, and I know this now because I've had the good fortune of I presented at the Healing ALS conference last fall, so I was able to test both practitioners and patients at that conference, and then from there went to the Frontiers conference where we were doing the plenary talk, and that's where we actually released the Ozonated Glycerin book for the first time. Um, at that conference, we were testing some of the top athlete physicians. These are some names that you would know. And they were shocked at their glycocalyx score. It was tanked. And yet these are athletes. They look like they should be super, super healthy. And so we did some intervention and 3 days later at the end of the conference tested and saw the shift and the improvement in the glycocalyx immediately. So, it's one of those things that it's not obvious. Some of the patients that I've tested, the husband is kind of more of a Kuna Matata type and doesn't do everything perfectly. Meanwhile, his wife's like, dress right dress on all of her, doing everything just perfectly. Her glycocalyx score was in the toilet and her husband's was high. And she's like, and I'm like, yeah, it's not necessarily what you always think. And the part that's really crazy here is I'm picking up on the fact that as a man thinketh, so shall he be. There really is this part about the renewing of the mind and the connection to our health. And I'm beginning to wonder if the glycocalyx is what shows that
Mm.
almost as clearly as a blood pressure. So it's pretty crazy. It's pretty wild. And so
So
one of
important.
the things
Yeah.
that's helpful with the ozonate glycerin is that when we get that measurement of the glycocalyx, start supporting that glycocalyx, which then you've now improved the entire ability of the system to pick up on the oxygen, to use the oxygen, to work with that glycerin component as well. That's really helping to bring a lot of that in. So when we do that, and then you bring that OG on top of it, I mean, it's hand in glove. The two work together so well together. So I'm thrilled to have the ability to actually measure the glycocalyx and see the differences that we're making.
Wow. Okay.
Shifting gears just a little bit, Pam, I think we all have heard of ozonated water, ozonated oil. Share with us a little bit the benefits of OG over these other methods. How do they differ? What do we need to know about in that regard?
They're all good. They all have
Okay.
their place. They all work a little differently. I think the biggest difference is that long-acting peroxide that we talked about. So like ozonated water is fabulous. There are people who drink ozonated water. It works beautifully. You can make it yourself. It's not very expensive to make. The big thing that I'm going to hit on, anytime we're using ozone of any type that we're consuming, for anyone who happens to be a layperson on this call, this does not go out and buy your $120 generator off of Amazon and start putting ozone into your water, okay? Don't do that. We want you to make your ozone with 100% pure oxygen, preferably with your tank, your oxygen tank, or you can do it with an oxygen generator. Just need to make sure that that generator is well maintained, that it's got, the fresh zeolites in it, and that we have a good concentration of oxygen coming out of there. So that would be the ozonated water. It's been very helpful for digestive issues, all sorts of stuff like that. The ozonated oils, there is a place and a use for ozonated oils. I was recently at an integrative health conference in Manhattan, and we're talking practitioner after practitioner coming up, loving the ozonated oils for use for skincare. Ozonated
Mm.
glycerin's also used for skincare. Actually, Karen, I think you have a story about a client of yours right now that is
Yeah,
using OG on her face, right?
yeah, and seeing amazing results. I tend to be an early adapter. Sometimes that's good, sometimes that's not as good. But I figured there was no risk in topical, and she had a spot of concern on her skin. And I said, I was just at this conference. I learned about this. I had already ordered some for myself and was using it topically as well as orally. And she ordered some, and that spot, I saw her couple days ago, it's all but gone. Just putting straight OG on the spot on her skin looked totally different, and all but gone. So I think the next time I see her, it'll probably have fallen off and have new pink, healthy skin growing underneath.
Well,
So,
here's the crazy part with that. It's actually how the Japanese got back into it. The Japanese are actually putting this into their skincare products, and they're charging
mhm.
a lot of money for those skincare products. And huge shout out to Gotera Shiota and the team there in Japan that rediscovered ozonated glycerin. And I do say rediscovered. There's some history there that was all but lost that we're just starting to pull back up on now. And with Shiota and his team back in the 2010 through about 2017 timeframe, rediscovered the OG, figured out, the stability of it and things like that, started putting it into their products. They do have a patent. Um, OG itself cannot be patented. It was actually originally discovered back in the 1800s by a French chemist in New York by the name of Charles Marchand. And actually, I am like deep diving Charles Marchand right now. His story is fascinating. But there is polyethylene glycol, otherwise known as PEG, in the Japanese products, which does shelf stabilize them for good. That part, is nice from that kind of aspect, but I'm not a big fan of putting PEG on my body. I just don't
Mhm.
really want to deal with polyethylene glycol. I like the OG in its pure form. So the ozonated olive oils, things like that, those work great. They can stay on the skin a little easier. OG, if you put it on the skin directly, can feel a little sticky. It's really, really thick. So from that aspect, sometimes people prefer the ozonated olive oil, but we are seeing more of a benefit towards like removing these little spots and things, taking off the age spots, using the actual OG. Interesting case recently that I had with one of my clients. Individual had a suspicious spot under the tongue, was told to go ahead and get it biopsied. He didn't want to get it biopsied because, we don't like cutting into things. It tends to proliferate it. So what he did instead is he started using the OG under his tongue, and he started taking and supporting his glycocalyx using the Revasca. He just recently went back into the holistic dentist. That spot is now gone.
Mhm.
And this is an individual who likes his cigars, likes his afternoon drink with the boys. And yeah, the one lifestyle change he made was just adding those two little things in and was able to push that back. Now, obviously, we always want to encourage the lifestyle changes. We'll continue to encourage those lifestyle changes. But for this particular individual, he was able to avoid some much more substantial issues and push that back just a little bit.
Hmm.
So why do you think it's gaining so much popularity right now, Pam? What's your take on the growth that you're seeing?
I think we're seeing the popularity because of the fact that, especially since 2020, we're seeing, I mean, cancer's shooting through the roof, right? The neurodegenerative diseases are shooting through the roof. The peripheral neuropathy is becoming much more common. And the OG, especially combined with doing the work on the glycocalyx, is what is really core to supporting and reversing that. So when you take and you look at doing all the therapies, and I know you guys just recently did a podcast where you talked about how to stop the spike protein issues. Those are all great. Don't get me wrong. I think we absolutely need to be doing that. But I'm looking at, okay, guys, you have to support the body and give the body the tools it needs and then be able to apply those types of therapies that then are able to be much more effective. You're not pushing that boulder uphill, right? You're putting the support in place and then things fall off much more easily. I think that dosing and everything else, timeline for making those things work will be much more rapid as we do the foundational support of the glycocalyx and using the ozonated glycerin to really tip that balance in favor of the body being able to heal itself.
So you've mentioned a couple of different things that it issues that it works well in uh, helping people recover from skin things, the lining of the blood vessels, dentistry. What is it? How are they using it in dentistry?
Dentistry is truly amazing. I'll tell you my own little personal story here. And my dentist had never heard of OG. He's a biological, IABDM, IAOT dentist, has all the training, was trained by Phil Malika, who's on our board, by the way, for OG Pro. He's a part of our board. And he's going to be helping us set up some IRBs in the future, which we're super excited about. But literally, he had never even heard of OG. And I come walking in, and I had a root canal that just needed to go. It was putting a constant body burden on my body. And I'm like, this root canal's got to go. Take it out. And so he went to take it out, and I'm like, and when you get it out, I want you to take 100% pure OG from Pure O3, and that's the OG that we recommend when we start getting into these types of really invasive type uses. I want you to put OG in that pocket and then sew that flap over. And he's
Mhm.
like, "Wait, what? Huh?" And I'm like, trust me on this. And he's like, well, I'm not so sure. And I'm like, here, talk to Dr. Jim Bridge. I just started putting him on the phone with Jim right there on the spot. And he agreed to do it. And we put OG in that pocket, sewed it over. I did zero pain meds. It also turns out it's a massive pain reliever.
Oh, wow.
So I
Yeah.
did zero pain meds. I did, you're supposed to do all the nasal rinsing, blah, blah, blah. It takes time, blah, blah, blah. 3 days, that thing was completely healed, and I was pulling out my own sutures.
Oh, wow. 3 days.
3 days, no pain. Now, granted, it might take a little longer if you have a severely compromised patient and pretty healthy, but 3 days. And I'm like, score. I've got a kid who is dealing with some real issues with cavities and things like that, not wanting to brush his teeth. I know this sounds counterintuitive because we're talking glycerin here,
Glycerin. Mhm.
but we had him mouth washing with ozonated glycerin
Mhm.
and started seeing some healing based upon that. I just got a report recently of a adolescent who is autistic. She is verbal. She has problems with her hearing, and she had horrible halitosis, and she was showing some evidence of gum disease. Her mom started her on nebulizing. For the After she nebulized that first time, she actually slept through the night, and she typically has trouble sleeping and wakes up multiple times in the night. Her mom says she slept all night. She's been sleeping through the night since then. She reported 3 days later that her hearing was better and her halitosis is gone, which is opening up a whole new area to me of, wait a minute, we need to start diving into these kids who've got these long-term chronic issues. And I should mention, by the way, that we do have PubMed research that shows that ozonated glycerin helps with rematricing the bone. So
Mm.
when we took and we put that into that pocket, a lot of times we have issues with cavitation, right? I'm pushing back cavitation by using that OG. So that's just some of the dental cases that are even leading into systemic.
Yeah. And I will add, I have been basically oil pulling
Mhm.
with the OG since because it is thick and it's kind of syrupy when you first put it in your mouth. It thins quickly with the saliva, but just kind of swishing it around for general gum health and mouth health and oral health. And I feel like I can tell a big difference just in my personal use since February. So
And it
yeah,
tastes sweet, so you don't get the
yeah,
protest
it tastes
from
delicious.
people.
Yeah,
Yeah.
Do
yeah.
you rinse your mouth out with water afterwards, or do you keep that?
I don't. I do it right before bed, and I feel like it just coats my mouth and teeth as I sleep. And yeah, I've been very, very pleased.
And actually, you've got a slide in the slide deck there where we've got the testing thanks to the Japanese. Again, huge shout out to Shiamoto or Shioto and that group there. You will see that we actually, and that's actually Shioto right there who did the rediscovery of the OG. Great guy, by the way. Keep going down through the slide deck there. Stop real quick. Go up one. It does inactivate SARS-CoV-2. It is enhanced by the presence of blood, by the way. So just a quick little shout out here for you practitioners who are doing prolotherapy. We're now doing what we call prog therapy, which is we are adding and doing OG in the place of ozone, and we are getting longer impact. And Dr. Jim Bridge is finding that in the animal model, that in 8 weeks, he can completely reverse issues that he's seeing in the animal population, basically rebuilding joints in animals at this point, which is sounding pretty remarkable. Actually, if you go up towards the front of the presentation, there's 2 points I want to hit regarding OG real quickly. That's going down. Let's go back up. There are 2 points I want to hit. Keep going up towards the slide 15, 14, 13. Keep going up, 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 up. I think it's up in the presentation. You're seeing some of the history there. There we go. Stop right there. It's slide number 10.
Okay. Oh,
You're on number,
You're on number 9.
there you go,
There
number
you
10.
go.
The bactericidal properties of OG. This is a study that the Japanese did, uh, looking at Bacillus subtilis, Candida, looking at MRSA. This is exposure to ozonated glycerin at the 1 minute, 10 up through the 120-minute mark. I cannot say this enough. It takes out MRSA. It takes out Candida. It has a huge impact on mold. Now, here's the deal. Mold screams when it gets hit with OG. You will see a Hertzheimer's response. You have to start low and slow. So I've got an individual right now who said they nebulized OG and they got worse They felt like they had more fluid, more constriction, more of a difficulty breathing. I'm like, you have definitely got a fungal issue going on in your lungs. Let's slow that down. Let's look at bringing in some other therapies to kind of support. We're still moving forward with the OG, but absolutely it made a difference. Now, here's the to the point that Karen just made with leaving it on her teeth. What is it doing to the beneficial acidic bacteria, Bacillus subtilis? It does, decrease it a little bit, but it is not destroying the beneficial bacteria.
Mhm.
It's only hitting the pathogenic bacteria, fungal, so forth and so on there. So, like I said, also, we've also learned that this is anti-protozoal. So, when you think about that, most people have Lyme hiding in their gums. We think that OG could be a key component in supporting with those Lyme cases, those mold cases, and things like that. Quite often, the key is it's better tolerated orally in those cases than it is nebulized. You start hitting those sinuses, and they will definitely let you know that they're getting hit. You'll see them just massively starting to drain.
Mhm.
And that's a good thing. It's just sometimes too much too fast. You got to be
So
able to.
don't you recommend, Pam, that maybe people start with one drop under their tongue, basically test the water? How do they respond? Can you
Exactly.
go into that a little bit, the
Yeah,
safety and
absolutely. We
how to
start with
approach?
Yeah. We start with one drop under the tongue. And then if they tolerate that, and by the way, the guy who had the not the spot under his tongue, he reacted to one drop under the tongue. He
Mm,
actually had a small Herxheimer's reaction. So
mm,
what we recommend doing is try that one drop. Okay, if you react a little bit, great. We do have the ability to bring on some supportive things that, binders and things like that. And then we just
mhm.
slowly start working them up. So if you tolerate one drop, then we go to 1 milliliter, and then we start going up based upon weight. It is 1 milliliter per 30 pounds of body weight. Would be, getting up to a dosage that works. Some people can go 1 milliliter per 20 pounds of body weight and be just fine. But most people we find we get up to 1 milliliter per 30 pounds of body weight, and that tends to be their sweet spot for using the OG. When nebulizing, some people can do a 1 to 10 ratio. By the way, we just put that in water. I use distilled water just because I don't want any other things in there, but it does not have to be sterile by any means. So I go ahead and just do 1 milliliter, 10% solution. Most people we start at a 5% solution, particularly if we suspect that they've been in a compromised environment where they've had mold exposure, things like that. We will start with just nebulizing for 2 to 3 minutes to see how that goes. We don't do it at night before they go to bed. Do it in the morning so that you have time to work through all that drainage type stuff. And then if people respond well to that, we'll go up to 5 minutes, and we'll nebulize up to twice a day.
Awesome. So someone may be listening to this, it's a practitioner that would be a little skeptical or just not quite ready to, I say, get in the pool. What would you advise? What would you say do? How would you approach that?
Well, like all of us practitioners, we tend to test things on ourselves first.
Hmm.
So yeah, exactly. Just play with it yourself, play with it with your family. I
Yeah.
had a physician who was extremely skeptical, and then he caught his daughter's cold. And I literally just gave him a little pre-mixed bottle and said, try it. Now, this gets to the fact of how long is OG good for at room
Mm.
temperature. Okay, this is not just set it on the shelf and leave it there. Okay. In fact, I think probably right around slide number 9, Stephanie, you've got a slide there that actually shows the Japanese testing of how long OG is good outside of a refrigerator type session. Yeah, that's exactly it right there. So what you will see is that when you have OG at room temperature, you can see it falls off there and is about, half of its viability right around that 100-day mark. So at the 3 month mark, you've just lost 50% of the singlet oxygen in that ozonated glycerin. And then you can see it dissipate. So by the end of a year, it's pretty much dead. Okay. Now, what's really wild is if you put it in the freezer, look at that. It is just good indefinitely. It never freezes to a solid. It just becomes thicker than molasses in January. But
Mhm.
you can pull it out of the freezer, heat, let it warm up a little bit, and then you can pull it with when we have to pull it as a liquid, we just use a syringe to pull it,
Fringe.
a lower syringe, or we'll take and use a 14 gauge needle to pull it up once we get it up to room temperature. If you keep it in the refrigerator, you can see that it is really good in the refrigerator, for literally a year. So, what we end up doing is we will go ahead and make up our solution for nebulizing or for using as a nasal spray. Now, if I use it as a solution for a nasal spray, again, I'll do that 10% solution, and that can be done in sterile water. But I will use that solution up within a week. Okay, if I'm keeping it out at room temperature. And of course, the warmer the conditions, the faster it dissipates. And then I'll rinse it out and start over with a new solution. We have seen cases where Tobias Segal, who is the founder of Puro 3, which is the only OG that we use other than what I make myself. He found that he made up a nasal spray bottle, just, would spray it and leave it out. There is a point where this will continue to lose ozone to the point of where you will get a mold development because then you have the glycerin, you have sugar with no, oxygen there, and then now you're opening up a breeding ground. So that is why we're hard and fast on A, buy pure OG. Do not buy pre-mixed products unless they have the polyethylene glycol in them, which we don't advise. Don't like polyethylene glycol. It's not needed. Instead, buy the pure product, mix it up yourself. If you see anyone out there selling ozonated glycerin that's already diluted for you, that means that it's not going to last nearly as long, and you're going to really start having some issues with knowing how much ozone's in there. So we do not encourage or advise that in any way, shape, or form at OG Pro. What our advisory board of physicians and dentists and scientists say, buy the pure product, mix it up yourself, treat it like a mother tincture.
Can you speak a little bit to the parts per million, Pam? Because I was really impressed over the concentration that this product contains. I mean,
10,000 parts per million. So I'll give you an example. We now have OG in capsules, and that's been we're testing that on SIBO, small intestinal bacterial overgrowth.
mhm.
And two of those little capsules are the equivalent of a major auto hemotherapy. So, like when you do 10 pass, yeah, you got 10 pass in two little capsules. And we don't have nearly the reactivity level because, again, we've got that low, slow, longer action. So, we're pretty thrilled with what we're seeing there. And of course, from a cost perspective, you're talking $2 versus an MAH therapy cost. I just had a major trainer for EBU come spend the weekend with me. He just participated in our clinic that we have here this last Friday. And he's like, I see this making a major change where people have been going to do EBU, which is $1,500 a session, takes, thousands of dollars equipment, intensive time, practice, all that type of stuff. We can do a lot of this much more easily with IVOG. And we've literally done IVOG in not just in the clinic, but just popped up and did it right here in my home. Um, no problem. I mean, it takes 15 minutes to put together. It takes less than, 30 minutes to run it. And we actually have a case right now, which is a woman who has a suspected brain tumor. Because of the fact that she was 20 some weeks pregnant, they didn't really want to get aggressive and go any deeper. Mainstream system kind of threw her out the door. Found out she definitely had some environmental exposures based upon where they saw that suspected tumor. I suspect what we're dealing with is probably a fungal ball. And so what we did is we started doing nebulizing OG, IVOG. We're doing some other things just to support her throughout that pregnancy, and she's doing fantastic. She feels great. She said that she feels like, she feels better this pregnancy than she did in her other pregnancies. And this is someone who is staring down a very serious brain cancer diagnosis.
I'm glad you mentioned that EBU because I was thinking like, how does this compare to those treatments?
They're different. I'm not saying that there's not a place for EBU. There certainly is a place for EBU. There's a lot of claims being made regarding EBU with removing spike protein and things like that. There's a lot of stuff going on in that field right now that is up in the air, so we've just seen some stuff come out from Switzerland regarding the filtration and the filter. And there is a question of whether or not sometimes those filter can actually be contributing to contamination versus taking it out. There's a new filter type that's come out that supposedly is better. So there's just a lot going on there. And the reason why I like the OG is I don't have to deal with any of that. I do think that there's a place for EBU. I really do. But I think that OG can be used as an adjunct therapy to stretch EBU. We don't recommend doing EBU and then running OG as the final flush through. We do not recommend that. And the reason is because if you have someone who has a negative reaction to EBU, like let's say they have a bit of a Herxheimer's response, well, now you've made it much more difficult, because you're going to continue to prolong that oxidative therapy. So I really would like, okay, let's get you through the EBU. Let's see how you did. Now let's bring oral OG on board, or let's support with IV OG so that we're not in the potential issue of giving too much oxidative therapy at one time. When I was at the conference in Manhattan, I had a very well-intentioned RN come up to me regarding a case that she experienced with her husband. He was already compromised. He had some dental work done, a dental surgery done under a local anesthetic. They used ozone gas and OG very appropriately during the dental procedure. The next day, to help him along, she took him and did some high dose IVC. Now, what have we just done? We've just stacked oxidative therapy on top of oxidative therapy. He blew into MCAS, mast cell activation syndrome. And I'll tell you what I think happened is, first of all, he had an underlying fungal issue. I think it screamed at all of the oxidative therapy treatment. And I think what's happened is it was, looking at that redox factor, it was too much, too hard, too fast, at which point there was a need to really move into more of those antioxidants, that redox type therapy. Vitamin C, we both know that there's this hormesis effect with oxidative, reductive, that cycle, right? And I think a lot of well-intentioned practitioners and lay people don't understand the finite things that are going on in there. Full disclosure here, Karen was way too gracious when she said what she said earlier. Man, the more I learn, the less I know. I'm learning along with you guys, which is part of the reason why I'm grabbing these practitioners, some of the top experts in microbiome, some of the top experts in the chemistry, one of the top docs on redox and stuff like that. And I'm literally putting them in a room together on Zoom calls and stuff like that and saying, okay, guys, what's going on here? Because we need to figure those things out so we can provide good information out to practitioners, which again is the whole reason why we created OG Pro. At the end of the day, what we're after with OG Pro is we want to be gathering all of these case studies. So like the one that Karen just shared, we want to put that all into a database that is accessible to the practitioners and then use the tools that we have now with AI and things like that so that we can put out real-time guidance that is top notch. And I'll give you, two reasons why. One, that person who experienced the issue that she experienced with her husband, we don't want to see other people experience things like that. Two, there's a situation where an individual was making their own ozonated glycerin and they were injecting it into a patient and they ended up causing a tumor lysis. Now, this was a highly compromised patient already, but let's avoid those types of situations. There's another situation where there was an individual who was making ozonated glycerin, but they were making it in Africa where the temperatures were very warm, and they couldn't figure out why they weren't getting good OG production. Well, they figured out that they could take a little small refrigerator, they put the OG production component inside there with their little, glass cylinder, ran the whole thing into that refrigerated. Now they're getting good OG. If your temperature is too warm, you're not going to be able to make good OG. These are all the things that we're capturing rapidly and trying to build out that database. So for those who join OG Pro, why is there a fee? Because we're building the back end. We're building out all of the things that we need to build out in order to provide the infrastructure in place. And the reason is there's nothing out there right now for long-term guidance on this stuff other than the books that Charles Marchand wrote back in the late 1800s, early 1900s. That's the only thing we've got right now, really, for the deeper data dives. So we're trying to pull that data together rapidly and put it into a usable format for practitioners so that we can continue to support patients safely and not do any harm.
So where is the evidence the strongest, and where do you see the gaps still?
The evidence has been strongest in cases like what Karen showed you in the physician whose daughter caught a cold, and I've seen this with kids too. We give them a little bit of OG when they're thrown up and they get the stomach flu, and 4 hours later they're back out playing. I
Mm.
mean, there's your strongest evidence right there, super easily. Injecting into joints, we've seen really good evidence there. Where is it much more dicey? Carcinomas versus sarcomas. We're still figuring that out. There was a hemangiosarcoma that Dr. Bridge did an intraperitoneal injection on a dog. And by the third injection, the tumor shrunk up and disappeared, and the spleen had returned back to normal. And he's got the visuals to prove that one. So we are looking at and working with a different type of a liposarcoma case right now, where we are looking at some of those same principles and does it work in a liposarcoma? Um, that's going to take a lot more research, a lot more diving. That's why we need practitioners to come alongside us, at all levels, at the level that Karen's at, where she's playing with it with nebulizing and topical and things like that. Those that are doing prolotherapy, that are open to doing injections into joints, please come join us so that we can start working on those things together. And then, of course, I am actually going to be visiting a clinic later this week where we are going to be videoing and capturing data of some of the remarkable results that they've been having. I mean, top notch. Haven't seen this outside of, outside, other than outside the United States, have not seen this type of success. And then that will be presented at the American Academy of Ozone Therapy conference coming up this May. And also will be presented again at Frontiers Therapy Conference, which will be this November. And so we're starting to pull all that data in, and we will also be doing, that level we do strictly in our membership group. That is not common consumption stuff because we need to be safe. And we have those practitioners are actually a part of our advisory board. So we want to be walking next to practitioners carefully in some of these upper level courses.
So
Well,
what is the legal and regulatory status here in the US, Pam? What do offices need to be aware of?
Legal and regulatory in the United States regarding ozone is kind of crazy. FDA, in fact, there was a paper that just went up to Kennedy recommending that ozone be pulled off of the it's dangerous list.
Mm.
Okay. Absolutely, for anyone who's a total lay person out there, do not inhale ozone. It does not go well. It is a gas. Don't do it. It is very, very contraindicated for your lungs, and your body will tell you very quickly. But the ozonated glycerin, it's a totally different story. So we put a recommendation into Kennedy to pull that out of the FDA guidance that ozone is dangerous. Um, we've all been told that it's a gas that's going to absolutely, destroy the environment, destroy you. No, It was created for a purpose, and we are using it, it really actually is an amazing tool. So it is not a standardized therapy. It does not have FDA approval at this point in time. We consider it experimental. When we talk about it being experimental, some of the top clinics in the country are actually using it at this time. It is just another integrative therapy, just like we know with a lot of the other integrative therapies, vitamin C, high dose IV, things like that. We just need to get consent. So part of what we're doing right now in OG Pro, and my huge accolades to those who've been patient with us. We have done the webinars that give the all the practitioners the initial training that is available for practitioners to get a hold of through OG Pro. Those are being converted into a course right now. In that course, it's going to be everything that that clinic needs in a box. It will have the waivers in it. It will have the protocols in it. We're in the process of rapidly building that out. Anyone who purchased the webinar because they just, wanted to get started right away, they're gung ho, they're getting moved into that course at no additional charge. So they will get all of the additional tools that they need. And we are working with those practitioners one by one on what that FDA regulatory picture looks like.
And I know you mentioned the Pure brand along with the OG Pro. Are there any other? How does someone know that what they're getting is legitimate?
Literally, the way at this point in time, the best way to know whether or not what you're getting is legitimate is to test it with the hydrogen peroxide strips. The process for doing that is right here in this OG Pro book, which is coming up looking, kind of blurry. I'll pull it back there, but the testing process is in there. So we do recommend that people test their own OG. Also be aware those OG strips. Yep, you got it perfectly. Those OG strips, when we use those peroxide strips, they do go bad pretty quickly. We recently had an individual who was well-intentioned, who was one of the other manufacturers, who sent out a note to all the practitioners and their entire patient population to tell them that OG was not viable 90 days or 30 days later, even if it had been refrigerated. Um, and then recanted all that when they figured out that it was actually the hydrogen peroxide strips. This again points to the reason of why we want people to be a part of OG Pro. Let us walk next to you on all of that. A lot of this is if that individual had just consulted the experts, wouldn't have had all the panic that occurred across the entire organization, because we could have walked them through the fact that, hey, it might just be your strips. Get a new batch of strips and try it again, or here's some other ways to test it. So here's what we found so far. Pure O3 parts per million is 10,000. When Dr. Jim Bridge makes his homemade OG, when I make my homemade OG based upon the methodology that I was taught by Dr. Bridge, it is 10,000 parts per million. The Japanese formulation is at 200 parts per million and has PEG. When we've tested the other companies out there, we're getting variability from batch to batch. So at this point in time, this affiliate disclosure here is Dr. Jim Bridges' affiliate disclosure. He does receive royalties from Pure O3 for their OG. He is my co-founder. He is the co-author of the book. Full disclosure here, it is the one we're using for all of our clinical trial purposes, just because we need standardization. But look
Okay.
for those things of CGMP, which is the process that that Tobias Segal is doing right now with his Puro 3 company. We want to see that out of anyone else who produces it. I actually am going to be traveling to go do a review of his manufacturing process because I want to be able to show people. I'm opening that door for all the other manufacturers as well. I will share their manufacturing processes, and I want to see more producers out there for OG, not just Tobias.
Okay. So now,
So
oh, go ahead.
I was going to say, let's say people are listening to this and they're like, oh my goodness, I have someone that could benefit from this, or they can benefit from this. number one, where do they start? And number two, how does someone find a qualified practitioner for more of the IVs or injections or, walk us through kind of the individual finding a place to a professional already doing it.
Excellent question. Individually, they can certainly just buy their own bottle from the Puro 3 there. There is a discount code I think they can use. I think the discount code is Glenn, Glenn, and that'll give them a 10% discount. Um, the OG that you can certainly start nebulizing yourself. You can use it topically, you can use it orally, you can use it, periodontally. So certainly you can play with it those ways. Start slow. More is not better. What I'm going to encourage people to do is go ahead and get the OG Pro Notes book at ogpro.org so that they can, the guidelines are in there. Okay, how to use it is in there for both lay people as well as for practitioners. There's also a lot of case studies in there. So all that covers that individual level use. For those who want to go farther, OG can get expensive quickly if you're using it orally. I'm a big fan of those of us who are DIYers. Learn to do it yourself. I'm making my own, and certainly other people can make their own as well, but make sure you learn to make it properly. And we do have a course that helps people with that. For those who are looking for practitioners that are using it, there are practitioners who are coming on board. We're rapidly working through to make sure those practitioners are properly trained. And here in the very near future, we will have a practitioners list on the OG Pro site that will be available to individuals who are looking for OG practitioners. Additionally, in the meantime, you can email us at advisor@ogpro.org. That is advisor@ogpro.org. And we will look, in your area and, the little telephone network's pretty good. We're pretty good about knowing where each other are at.
Okay,
That's good.
excellent.
I just want to show a quick look um, for everyone so they can see that website, www.ogpro.org. And
And by the way, that presentation of all the different things that we've done, that's the course that we did on the 30th of January. That course is available on the ogpro.org website for purchase. Also, there's a presentation that we just did a couple of weeks ago that is free and available to everyone in the public. So if they go on OG Pro, they can just go ahead and sign up and see that webinar. If they go underneath the blog, you'll see our past webinars that we've done there, as well as interviews with some of the top physicians from across the country. So there's interviews there with David Minkoff, Frank Schallenberger, those that are, kind of on the cutting edge of some of the regenerative medicine type of work. So that's all there.
okay, well, fantastic. I know I'm already thinking of all the different people that I want to mention this to. Well,
Yeah.
I just appreciate both of you and your time. Is there any final thoughts that you want to share with everyone?
I have one final thought, and that is looking toward our, excuse me, May 22nd date. If there's a provider listening that would be interested in coming to that, I would ask them to please reach out to me. Um, I'm happy to give my email. It's basically my name, the letter K, and then Gadol, Gadol, at gmail.com. I'm happy to share more information, gather names on that, and would welcome anybody who wants to come and learn. And let's make it as a successful day as possible. Um, so just honored for the privilege again.
And if practitioners have trouble reaching Karen, what they can also do is they can go ahead and come into the OG Pro. They can drop a note in there, and I will just toss those over to Karen so that she can keep that list and move forward on that as well. And as far as dealing with the patient population goes and people who are interested in learning, certainly we can always also set up testing individuals and testing their glycocalyx. There is a fee for doing that for patients, just because I have to keep the lights on, cover my travel expenses, those types of things. But we would be happy to do that as well.
Well, a work woman is worthy of her wages too.
Amen.
All right, and we may get together again soon and dig deeper into the effects of OG on the glycocalyx. I'm excited about that.
I
Mhm.
am too, as I'm still learning and writing the book. It's like I gotta get this book done. It really is absolutely a joy. And if nothing else, I would say the most important thing you can do for your health and for your glycocalyx is being intentional. Intentional about your time, intentional about your relationships. Spend that time out in nature. Take time to breathe. Busy is not better. Being very intentional. So my final words that I would tell you is at the end of the day, having gone through, and I didn't share my personal story here, but it's on a website called radicalresilience.health underneath the about, if anyone wants to see that story. It was pretty tragic. And so everything that we're doing now with the OG, that we're doing with the glycocalyx and things, it comes from a position of wanting to give back and knowing that there's a better way, and that the
Mhm.
more we decentralize medicine, the better off we're going to be. That the answer really is in our faith, it's in our lifestyle, how we walk things through. So there's actually something called the OG support system that helps people, that's on the OG Pro site, that people can get, that they can literally do their own little self-assessment. They can retake that quiz once every 30 days, and it literally gives personalized recommendations that will walk them through how they can take and start improving some of those areas. And we're talking about great tools, right? OG is a great Swiss Army knife, right? But at the end of the day, if we don't do the work spiritually, emotionally, and physically to come into alignment, we're kind of wasting our time.
Mhm.
Very good. Yes, I can
Yeah.
feel the renewal of my mind already. Just listen. Oh, I
And
appreciate
don't lean on your own understanding because that always messes me up.
Yeah.
oh,
Yeah.
I appreciate that heartfelt sentiment. And yeah, you've shared with us from your mind and your heart today, both of you. Thank you very much. All right, everyone, have a good day and keep this tool in mind. And we pray for blessings on everyone. Bye bye.